Hi and welcome to the channel Love Obstetrics and Gynecology. This video is regarding the procedure, dilatation and curettage. So first up are my indications. It can be done as a diagnostic procedure such as in infertility patients or where you want to rule out endometrial hyperplasia or endometrial CA, and therapeutic in cases where you want to remove a polyp of an abnormal uterine bleeding patient. So pre-op you require the consent of the patient. The bladder needs to be evacuated. It is done under anesthesia, which can be either a paracervical block or a short general anesthesia. And a bimanual pelvic examination under anesthesia is a must to know the size of the uterus and rule out any adnexal mass. Moving on to the procedure now, the first instrument you require is a sponge holding forceps. This is for cleaning the patient from up the level of umbilicus to below the level of thighs, and you want to clean the inside of vagina. So this is a sponge holding forceps. This is the rings where you grasp the sponge, betadine soaked, and this is how you hold your instrument. The second instrument that you require is a Sims speculum or Sims bi-bladed non-self-retaining posterior vaginal wall retractor. So this is for retracting the posterior vaginal wall like this, and you require assistance for this one, right? And you do not enter the speculum as such. You go along the lateral vaginal wall and rotate the speculum to depress the posterior vaginal wall, and then the assistant holds it. The third instrument that you require is a valsellum. This is a valsellum. You can see that there is a curved portion in it, and that concave part is kept towards the pubic bone. So this is for holding the anterior lip of the cervix, right? You go through the vagina all the way up to the cervix, and then you hold the anterior lip of the cervix and then arc the instrument towards the pubic bone so that you can easily visualize your external walls. Then the fourth instrument that we have is uterine sound to measure the uterocervical length. So you insert the instrument through the vagina, through cervix, cervical canal to the uterine cavity all the way up till the level of fundus where you'll find a resistance, and then you move your index finger of the instrument, the hand you are holding the instrument in, till the level of external os, and then take the instrument out, and you have finally measured your uterocervical length, which in this case was 6 centimeter, and it also acts as your first dilator. The fifth step is dilatation of the cervix, and this is a Hagar's dilator. This is double-sided, right, of different sizes available, and this is how you hold the instrument in like a pen holding fashion. And the portion that you want to dilate is this portion, the cervical canal and the internal os. You don't want your instrument to go inside the uterine cavity. So your ring and little finger stay outside on the perineum, and only a small portion of instrument goes inside the cervical canal, and you progressively increase your dilator size to have an effective dilatation. So next last step is the curettage. The curettage you require is a uterine curette. So these are the rings of the uterine curette. It has a sharp end and a blunt end, and sharp end is used in the gynae procedure. And this is how you hold the instrument with index finger acting as your guard. So index finger is kept as per the UCL you have measured, right? So that you do not go excessively inside the uterine cavity and perforate. So this is how you insert your instrument, and your index finger is going to act as a guard kept right at where your UCL was, and you meticulously curette all the walls of the uterus along with the fundus, and just like this gently curetting all the walls. And then finally, when you have done with the curette, so you move your curette outside, and as you do it, the sample gets collected on the Sims speculum, where you can send it for the histopathology, or the excess can drain down. In case you do not keep your index finger as a guard, high chances of perforation are there. So this was all regarding the procedure, dilatation and curettage. Post-op, your patient will require analgesic, antibiotics, and you want to review your patient with a histopathology report of the sample sent. So thanks for watching, and do like, subscribe and share the channel Love Obstetrics and Gynecology.